Pregnancy is a very happy event in the life of a woman. There's so much of anxiety, there's so much of anticipation, there's so much of excitement in the family that a new addition is going to come and you have to prepare for it. Alongside, there is a lot of anxiety as to what the pregnant woman should eat, how she should be sleeping, how she should be talking, how she should be sitting. So there's so many things, so many people giving advices that it is bound to put this pregnant woman into so much of anxiety. Especially if it's your first pregnancy, you will have a lot of people giving you so much of wanted as well as unwanted advice. So the anxiety that a woman experiences during pregnancy, it can have deleterious effect on her as well as on the baby. So it's very important that you learn to control this anxiety. There will be an anxiety level which is understandable, but you should not allow yourself to go too much overboard with anxiety. I'll give you a few tips as to how you can overcome this anxiety. Let's go at least about 6 to 8 weeks before you get pregnant. There's something called pre-pregnancy counseling, which is very important for women planning a pregnancy, where you should be meeting your doctor and he or she will be advising you what you should be following. The most important advice is that you will be asked to take folic acid. Folic acid is a very small tablet. It's a very simple tablet belonging to B complex, and it has been proved that taking folic acid before you conceive reduces the abnormalities of the brain and the spinal cord. So it's very important that you get into the pregnancy while you are on folic acid. That's the first point. So even before you get pregnant, you are now sure that you have been taking folic acid, so there's no risk of abnormalities of the brain and spinal cord for your baby. The second one, when you discover that you're pregnant, there are people who tell you don't go to the doctor for the next 3 months. You have to go to the doctor after 3 months, and that itself causes a lot of anxiety because you don't have people giving you professional advice. And the professional advice is that you need to see your doctor the moment you test positive for pregnancy. So if you think you have any symptoms of pregnancy, or if you have done a test at home and it turns out positive, you must be seeing your doctor. The two main reasons why you should be seeing your doctor is we have to assess if your pregnancy is normal. Many a times the pregnancy that is growing inside the uterus, there's only the sac growing and there is no baby, in which case we call it as a missed miscarriage or a blighted ovum. Sometimes the baby may be there, after some days the heartbeat also may go away. So it's very important that we distinguish this abnormality at the earliest itself. Similarly, there may be pregnancy outside the uterus, which is ectopic pregnancy, and all this must be diagnosed at the earliest, as soon as you conceive. So there is the importance. So when you see the doctor, your doctor may advise you to go in for a scan. Again, the ultrasound scan is something that has got a lot of misconception amongst people, and many of them are scared to submit themselves for a scan. Let me tell you, the ultrasound scan makes use of ultrasound waves. You cannot see or hear those waves. They are a group of electromagnetic waves, and we use that to see the baby. The first ultrasound was done way back in 1960 by the discoverer, who was Ian Donald, and from there up to 60 years now, there has been no abnormalities reported when the babies have gotten ultrasound. So get it off your mind that getting an ultrasound is harmful for the baby. In fact, if we detect, the ultrasound will be able to tell us if the baby is doing well inside, if the baby has got any abnormalities, if the baby is moving well, if the liquor around the baby, the water around the baby, if it is fine, where is the placenta, if the baby is moving well, baby is breathing well, and if the mouth of the cervix is well. So it gives us so much of information which we cannot get just by touching your abdomen or even hearing the baby's heartbeats. So rest assured that ultrasounds will not cause any harm on the baby, and you may need to get it done more frequently if there are any other associated risks. So please follow the advice of your doctor. The second thing is the blood test. So many people are averse to getting the blood test, but this is very important in pregnancy, and it will reduce a lot of your anxiety, because we'll be able to know whether you have anemia, which is very common in our country, and we would like to know your blood group. We would like to know if you have any diabetes, because diabetes in pregnancy is also common in our country, and we'll also do some certain tests to diagnose whether, or to detect whether you have any infection. So you've got the ultrasound done, you've got the blood test done. It reduces so much of your anxiety now if the doctor tells you everything is normal, isn't it? Now the third point is taking medicines. So we do prescribe certain medicines. As I told you, folic acid is often continued up to 3 months of pregnancy, and after that we switch over to iron and calcium. Many patients are again averse to taking medicines. Trust me, even the best of diets will not give the amount of iron that you need in pregnancy. Therefore, it's imperative that you need a supplement in order to prevent anemia. Similarly, calcium supplements is given so that you have strong bones, the baby has strong bones, and you don't have any problem while breastfeeding the baby. So getting all these things done comprehensively and going in for regular checkups will reduce your anxiety to a great extent. And a very important thing that I have noted is the patient's choice of doctors. It is not the place where you go to. It need not be a swanky place, but you should be very aware of your doctor, the qualifications of a doctor. For example, if you're going to a supermarket, you look at what is on the label of even a tea powder, whether this is good. So similarly, when you're subjecting yourself to examination, not just in pregnancy, in general also, you always should see if your doctor is qualified enough to take care of you. This is a very important point, and I thought you need to know, because if you're going to the right doctor, then it reduces your anxiety almost to nil. So it's very important. The choice of doctor is also very important. Now, we've often seen that the pregnant women are given information whether they want or not. There are many sources of information. It could be your family members, it could be your friends, and most importantly in this day of World Wide Web, it is the internet. So often you Google any small word that we say anemia, and you Google, and on anemia there are so many scary things and you start getting scared. So it's very important, you should know where to get your information from. The best person to answer this is your own doctor. She may have a blog, or she may suggest to you a site, she may suggest to you a book which you could read, and then you could be updated about your condition. And secondly, the family members are also advised to be very supportive of the woman and not give her any wrong information or incorrect information, or compare her pregnancy with someone else's. Someone else might have had a miscarriage, someone else's baby may not have grown well, might have a cesarean section or lost the baby. So if these negative things, if you tell to the pregnant woman, it is bound to increase her anxiety. So you have to be more supportive of her and fill her with positive stories and positive attitude. Also, the entertainment plays a huge role. You are advised not to watch serials, horror serials, or which will cause greater anxiety to your mind. You can see some light movies or light music or cartoons and keep your mind free of anxiety. Try to concentrate more on pregnancy. Try to enjoy your pregnancy. Keep away the negativity. There's another very important thing that you can do to keep away the negativity, and that is mental health. Pay attention to your mind. So you can do some breathing exercises which will also help you during normal labor, and you can do some meditation, and you can connect with people who are positive and spend some quality time with family. The anxiety is definitely more pronounced in first pregnancies, and these women may need more support from their mothers-in-law, especially if they are staying away from all of them, away in a different city with their husbands. These are women who need greater family support, and of course the doctor is always there to give you medical treatment and medical support, and you need all the support from the family. And please concentrate on your baby, and even you can put up nice pictures of babies in your room, which will increase the positivity. Another very important aspect for anxiety amongst these pregnant women is delivery. Most of them, even in the 3rd month, they ask us, are we going to deliver normally, doctor? Are we going to have a cesarean section? Which is very difficult to answer so early on in pregnancy. As your pregnancy progresses, as we discover that you are very low risk, and so there is no reason to be anxious, because most patients will go into labor by themselves. So your doctor will be able to tell you how to distinguish between false labor pain, true labor pain. And one very important aspect here is, as you near your term, it's better that you keep your bags ready. What you need in the hospital, what the baby needs in the hospital, and most importantly, all your records, it should be kept in one place, so that if you start leaking or if you have pains, all that you need to do is you pick up the bag and go to the doctor. So there's no anxiety in putting things together at this last minute. So this may be a very small thing, but this is very important. And then when it comes to labor, how do you calm yourself during labor itself is why it's a subject. We have so many things to keep you calm during labor, which your doctor will definitely discuss with you. So there is and your labor also will be monitored, so there is no anxiety for this, as long as you are in good hands. Remember, pregnancy is a physiological phenomenon. It's not a disease. It's a physiology, normal physiology. People have been delivering babies since time immemorial. So all that you need to do is keep a positive attitude, trust your doctor, go for regular checkups, get the regular scans done, take the medicines, and be positive, and you will definitely sail through your pregnancy.